Good afternoon, SO1.
Good afternoon.
We left off asking some questions about a helmet camera. Were you wearing a helmet camera on 3 May 2017?
Yes, it was.
And for portions of that day, did you have that helmet camera activated?
I did.
You know, our permission to show the witness what's been marked as Prosecution Exhibit 15.
For identification, you may.
Thank you, Your Honor. SO1, can you tell me if you see that on your screen?
I do.
And do you recognize at least the still image of what's displayed on your screen?
Yes, I do.
At this point, I'm going to click play on the video and ask that you review it. Did you recognize that video?
I did.
What was it?
That was when the patient was brought into the compound.
And when you say the word patient, who are you referring to at that point?
The ISIS member that was brought into the compound.
Was that video a fair and accurate image of what your helmet cam captured when you saw the ISIS detainee brought into the compound?
Objection.
Basis?
Form of the question, he said patient, he says detainee.
Overruled. Go ahead.
Was that a fair and accurate representation of that video when you saw the patient brought into the compound?
Yes.
Now, at this time, the prosecution moves to admit Prosecution Exhibit 15 into evidence and asks that the words for identification be stricken.
Defense objection?
No objection.
Without objection, prosecution exhibit 15 for identification is admitted evidence. The words for identification will be stricken.
Your Honor, permission to publish Prosecution Exhibit 15?
You may. That's my understanding that this, the published version will have audio with it.
It should, Your Honor.
All right. Defense, do you have any objection to the audio in prosecution 15?
No.
All right.
And playing Prosecution Exhibit 15. Did you recognize, SO1 Byrne, any members of your platoon in that video?
Yes, I did. Can we play the video one more time?
Yes.
Sorry, why are we, hold on just a second. Why are we playing the video again?
Can you recall, as you sit here right now, who you recognized, if anyone, from your platoon in that video?
Will you
Yes,
please
sir.
take the video down, government?
EOD 1 Mondragon in the corner.
And what did that video, Prosecution Exhibit 15, what did that depict in terms of what you witnessed from that day on May 3rd, 2017?
Depicted the ERD bring in the patient or the detainee.
Who else, if anyone, that you recognized were the individuals that were around that ISIS fighter?
The Iraqi General Abbas.
Did you take any additional helmet camera footage from that day?
Yes, I did.
Your Honor, permission to show the witness what's been marked as Prosecution Exhibit 16 for identification.
You may.
SO1 Byrne, are you able to see the Prosecution Exhibit 16 on your screen?
Yes.
I'm going to play that video. If you could please review it. SO1 Byrne, did you have a chance to review that video, Prosecution Exhibit 16 for identification?
Yes, I did.
Do you recognize that video?
I do.
And what does it depict?
It depicts the patient being laid on the ground on his back, and SOC Gallagher starting treatment on the patient.
And is it a fair and accurate representation of those of that video that you took from your helmet cam and the scene you saw that day?
Yes, it is.
Your Honor, permission to publish Prosecution Exhibit 16, or excuse me, prosecution moves to admit Prosecution Exhibit 16 and requests that the words for identification be stricken.
Defense, any objection to Prosecution Exhibit 16 for identification?
No objection.
Without objection, Prosecution Exhibit 16 for identification will be admitted evidence. The words for identification will be stricken.
Your Honor, request to publish to the jury. This also has audio on it as well.
Defense, any objection to the video played with audio?
No.
All right. You may.
Playing Prosecution Exhibit 16.
Hey, he's about to put him out, dude.
Yeah. Yeah, I'm going to help him.
Hey, Eddie, this is for my SIGINT strike. Let me know if you need help.
Removing Prosecution Exhibit 16. Your Honor, for the record, the phone call, the individual on the phone call on that line has been dropped.
Okay.
Can you describe the condition as you witnessed it of the ISIS detainee when you saw him brought into your compound?
Sure. The detainee was seemed in and out of consciousness. He was obtunded when we saw him. He was definitely having respiratory distress at the time.
Let me pause you there. Why do you say that he was having respiratory distress?
Because he seemed to be having trouble breathing when the initial triage was being done on the patient.
After that point, when the video turned off, Prosecution Exhibit 16, First, was that you that turned off that video?
It was.
What did you do next?
I believe I started to assist with treatments.
In that video, Prosecution Exhibit 16, did you see Chief Gallagher?
I did.
And what was he doing at the time?
He was triaging the patient.
Can you describe for us what was Chief Gallagher? You mentioned that he was in Prosecution Exhibit 16. Can you describe his appearance and any items of clothing from that video?
He had a ball cap on and our standard uniform.
Any physical features about his face that let you identify him from that day in 3 May 2017?
He had a mustache.
You see Chief Gallagher providing treatment to the patient. You begin to assist. What happens next?
Chief Gallagher did a cryothyrotomy on the patient.
What's that?
It is where you establish an airway with an ET tube, and it's a field expedient way to establish a definitive airway to secure the airway so the patient can breathe through the tube.
Does that procedure have a common shorthand name?
Crike?
Did you witness Chief Gallagher perform the crike upon the patient?
I did witness that.
You described a little bit the overall procedure. Can you tell the members in a little bit more depth, what does a crike entail?
Okay, so a cryothyrotomy or a crike entails grabbing the skin right above the crike cartilage. So if you kind of take the back of your finger and you put on your Adam's apple and you roll it down.
And for the record, the witness is gesturing to the center of his neck with his right hand and his finger just below his Adam's apple.
Judge, I'm sorry, can he maybe move his chair forward a little bit of the screen? The defense can't see the gestures he's making.
And that's the one where I think you can actually tilt that monitor just a little bit. There you go.
Can he make that gesture again?
Please demonstrate the location and where you start with the crike procedure.
Okay, so you take the back of your finger and you put it on the Adam's apple and you roll it down, and that's the cricothyroid membrane. So the first step of a crike would be to tent the skin around the cricothyroid membrane, and then you make a vertical cut to make your initial incision. Then you blunt dissect the skin around the cricothyroid membrane, and you take...
I'm going to pause you there. First of all, that initial cut that you were describing, about how large is that cut?
I would say 1 inch, 2 inches at most.
And is that a horizontal or vertical cut?
It is a vertical cut.
And then following that step of the vertical 1 to 2 inch cut, what was that next step that you began to describe?
You take a scalpel and you do, it usually comes in the cricothyroid kit, and then you do a horizontal cut to the left or the right by plunging right through the top of the membrane. You pull the scalpel out, you rotate it 180 degrees, and then you put it through the other side of the membrane to open up that 2 to 3 centimeter part of cartilage right there in that membrane.
You mentioned a membrane at that stage. What are you referring to when you talk about the membrane as opposed to that other cut that you just described?
Can you rephrase that question?
The membrane cut that you're describing, is that separate from the 1 to 2 inch vertical cut?
It is. That's when you cut through the cricothyroid cartilage.
So what is that first step or that initial step of the 1 to 2 inch vertical cut? What are you cutting there?
You are exposing the cricothyroid membrane so you can have a visual on the actual membrane itself to do your horizontal cuts.
So for the second horizontal cut into the actual cricothyroid membrane, how large is that cut?
2 to 3 centimeters. However large that cricothyroid membrane is.
You mentioned a little while ago, SO1, that the patient appeared to have breathing problems. Did that lead you to any particular belief or course of treatment being appropriate for him?
But we had heard what the mechanism of his injury was. It was an airstrike, and with the presentation of the patient, we concluded that the patient most likely had some type of pulmonary or lung injury or something going on internally.
And is a Crike procedure, how does that relate to that lung injury or the possible lung injury that you just mentioned?
The Crike could provide does provide a definitive airway if the patient were to stop breathing or stop supporting their own airway on their own.
Is there any particular name or diagnosis that you had related to how the patient presented before that Crike was performed?
As far as the lung injury,
That's right, S1.
possibly a blast lung.
Is there a technical name for blast lung?
It would be bilateral, potentially some type of insult to the alveoli, the actual lung tissue in the lungs themselves. It can cause a number of issues for the patient, from fluid in the lungs to pneumothoraxes or hemothoraxes.
What's a pneumothorax?
Pneumothorax is overpressure or positive pressure in the lung in the lung cavity that would prevent the lung from inflating.
Going back to the Crike, was that Chief Gallagher or yourself that performed the Crike?
Chief Gallagher performed the Crike.
And did you have a chance to observe the Crike after it was completed?
I did.
Did you make any changes or repairs to the Crike?
I assisted the tube going into the cricothyroid membrane and put a what we call a halo seal or a chest occlusive dressing to secure the Crike on the patient's neck.
Can you describe in a little bit more depth what a halo seal is?
Sure. Halo seal comes in every operator's standard blowout kit, and it comes in our med kits. It's a occlusive dressing. They usually come two per package. They're designed to stop an open pneumothorax, but they can be used to secure a Crike tube or a chest tube.
Why did you make any adjustments to the Crike tube prior to placing the halo seal over it?
And wanted to make sure it was seated properly in the airway and the cuff of the ET tube was completely inflated. Basically, the ET tube has a bulb on the end of it. It's a bulb that you blow it up with air via a syringe, and it secures it in place into the actual trachea.
Did you notice any issues with the incisions themselves that were required for Chief Gallagher to perform the Crike?
Not that I can remember right now.
Did you have to take any steps to deal with any sort of excessive bleeding or anything like that at that stage of the treatment of the patient?
No, we secured the Crike by inflating the cuff and then using the halo seal or the occlusive dressing to fix it in place.
How many halo seals did you use?
We used one.
So after the Crike, after you made those adjustments to the Crike, what, if any, other procedures were done to that patient?
Needle decompressions were done to the patient.
And what's that?
It's a needle thoracentesis. It's a prophylactic treatment for blast lung or a suspected pneumothorax or hemothorax, so blood or air in the lung cavity. And then we performed a chest tube on the patient.
If I may have a moment to pull up a prosecution exhibit.
You may.
While we're pulling up the exhibit SO1, who was directing the particular medical treatments you've described so far?
Chief Gallagher was the lead medic on scene.
Publishing what has been previously been admitted and published, Prosecution Exhibit 8. If you can move your monitor SO1 Byrne back. Do you recognize this photograph?
I do, yes.
And what does it depict?
It depicts the patient that was treated that day.
Are you able to recognize any of those treatments that you've described for the members in this photograph?
Yes, the crike.
And Your Honor, permission for the witness to enter the well to gesture at the photograph on the big screen to demonstrate that?
You may.
SO1 Byrne, if you could step into this area and utilizing the large screen monitor, if you could point out where the crike is.
The crike tube is right here.
And can you describe what you're referring to, where you pointed and when you said right here?
The crike tube is coming right off the chin of the patient.
Now, would it have been in the chin of the patient?
No, it was in the cricothyroid membrane.
And what is the color of that tube that you're pointing at?
It's a clear tube.
Thank you. While you're still up there, do you recognize any additional treatments that you described?
No, I do not.
Okay. And please be seated.
Government, would you take down the big screen, please?
Your Honor, Prosecution Exhibit 7 has previously been admitted but not published. The request would be to publish that at this time.
You may.
Publishing process. Not yet. Publishing Prosecution Exhibit 7 at this time. And are you able to recognize the scene depicted in Prosecution Exhibit 7?
Yes.
And can you describe that for us?
Sure. Somebody is checking the radial pulse of the patient in the picture. There is halo seals and a needle D on the left side of the patient. There's a bulky dressing on the left side of the neck of the patient. There is covered by a chest seal. There is a crike tube in place. And then on my left, but on the other side of the patient, there is a constricting band IV tourniquet on the patient.
Your permission for the witness to enter the well to point out the various items that he's described on the large screen?
You may.
SO1 Byrne, if you could do the same thing at this point. And you've described a few things for us. First of all, you mentioned halo seals. Do you see any halo seal packaging in this photo?
Yes. There, one, two.
Well, let me slow you down. The first one where you pointed it, where is that located in the exhibit?
Right here.
And when you say right here, can you describe it on the screen, which one you're pointing at?
Just above the elbow.
And is that above the tourniquet that you previously described? Or, I'm sorry, no, is that above a metallic, appears to be a watch on the patient's upper arm?
Yes.
And so what is that you're pointing out that's in that blood above the patient's arm?
This is halo seal packaging.
Where else, if anywhere, do you see halo seal packaging?
I see it right here by the torso.
And any other halo seal packaging?
Right here. These are two packages up top.
Okay, and what do you describe? You say up top and you pointed at two different packages. Where are those located in the photograph?
So these two packagings that were previously pointed out are the inside contents of the halo seal package, and the actual halo seals, the outer packaging. There's 1, 2, and then 3 right here. This is a different manufacturer called Sam Inclusive Dressings.
The one that you're pointing out as a different piece of packaging, is that a different color from the other packaging?
It is. It's green.
The other color, if you could point for us the other type of packaging for the halo seals that you mentioned.
They're brown.
Okay. So how many in total halo seal packages do you see in this photograph?
3 in total.
And how many, starting with the brown package that you described, how many halo seals come within that?
2 per package.
And how about the green packaging that you described?
1 per package.
What other medical supplies or treatment items can you identify on this exhibit on that screen?
There's combat gauze. There is
Let me stop you there. Where is the combat gauze that you just pointed at?
right here below the elbow.
And can you describe what it looks like?
It's green.
What else?
There is a constricting band for IV.
And which arm is that on of the patient?
The left arm,
And what color is that?
blue.
What else do you see?
I see nitrile gloves around the patient.
All right, SO1, if you could return to your seat. So you've described the needle decompressions and removing prosecution exhibit 7 from the screen, Your Honor. You've described the needle decompressions, the crico, or excuse me, the cric, the chest tube. Were you present and did you assist in the completion of all those procedures?
Yes.
Are those procedures invasive procedures that require cutting?
Yes, they are.
Did you apply any form of sedative to the patient?
Yes, I did.
And what was that?
Ketamine.
Can you describe for the members what the purpose of ketamine is and what its expected effects are?
Okay, so ketamine is an analgesic. It's it's one of the pain drugs that we carry in our med boxes. The reason that we use it, it's also called a dissociative, but the reason that we use it is it has no effect on the respiratory drive. So essentially you could give the patient the entire vial of ketamine. They would get a pretty good analgesic effect, but it has no effect as opiates would on the respiratory drive. So like morphine, for example, or fentanyl, have a tendency to kill the respiratory drive if used in abundance.
And what amount or dosage of ketamine did you give to that prisoner?
I believe it was 25 or 50 milligrams, between 25 and 50 milligrams.
What was his reaction, if any, after you administered the ketamine?
The ketamine has a sedative effect.
Did it have that sedative effect on that particular patient?
Yes, it did.
And was that applied before performing the procedures that you've described so far?
I believe it was.
So after all those procedures were applied, that you were performed, what did you do next?
After the chest tube and the needle Ds were completed on the left side of the body, SO1, Corey Scott, had come to the patient, and he was working on the other side of the body. And at that point, there was no more medical interventions that need to be done for that patient's particular mechanism or that set of injuries. So I ended up going back to where I was prior to treating the patient.
Did you check his condition at all prior to departing the scene?
I noticed there was condensation in the chest tube and fluttering in the valve of the Heimlich valve in the chest tube. There was condensation in the actual ET tube, and there was a rise and fall of the chest.
What did that indicate to you?
That the patient was alive.
How long were you away from the patient?
I'd say between 10 and 15 minutes.
And at any point did you come back to the patient?
I did come back down.
And what did you see when you came back to that patient?
The patient was no longer alive.
Are publishing Prosecution Exhibit 8 again.
Okay.
Does Prosecution Exhibit 8 depict the patient when you saw him during treatment or when you came back and saw him?
When I came back and saw him.
Can you describe for the members what, if anything, is different about Prosecution Exhibit 8 and what you saw when you came back to the patient, vice the way you left him?
The bulky dressing on the right side of the covered by the halo seal on the right side of the neck.
Our permission for SO1 Byrne to enter the well to point things out on the exhibit?
You may.
SO1 Byrne, if you could go ahead and head to that screen again and point out the bulky dressing on the side of the neck that you're referring to.
This dressing right here.
And can you describe what it looks like for us?
It's got combat gauze and it has a halo seal or inclusive dressing around it.
And where is that located on the patient's body?
The right side of the neck.
And what about the blood that's depicted in Prosecution Exhibit 8? Was that there before you came back to the patient?
It was not.
You may be seated. Taking Prosecution Exhibit 8 off. That gauze and halo seal that you described, were those there for the crike that Chief Gallagher performed?
They were not.
Was that blood there for the crike that Chief Gallagher performed?
That was not.
The halo seal that you applied related to the crike, was that depicted in that halo seal that you just pointed out?
Can you repeat that question?
The halo seal that you pointed out on Prosecution Exhibit 8, was that the same halo seal that you applied to stabilize the crike as you described earlier?
No, it was not.
Your Honor, permission to publish what's already been introduced and published. So Prosecution Exhibit 6, I believe, has been published.
You may.
Do you recognize this photo?
Yes, I do.
And what does this depict in relation to the previous photos you've seen so far?
This depicts the other side of the body.
And I'm sorry, continue, SO1.
It depicts a chest tube, and it depicts a fast one, which is an interosseous IV.
Where is the fast one on the body?
It's located in the center of the sternum.
Was that an additional procedure that you performed?
Yes.
Does this also depict any, I know you described previously that there were 3 different wrappers and 5 potential halo seals in play here. Does this depict any of that halo seal packaging from the other angle?
There's one other halo seal package above the right hand.
And the right hand of who?
The patient.
For the other procedures that you described, let's start with the chest tube that's depicted in this exhibit. Did that require a halo seal?
Yes, it did.
And where is that located?
It is around the chest tube.
And so that's one halo seal. How many halo seals did you yourself apply to this patient?
2.
And which ones were those?
The one around the chest tube and the one around the crike.
Do you see any unused halo seals anywhere in this photo?
Yes, I do.
And where is that located?
Just on the left side of the patient's torso, on top of the chest tube. And then there's another one on the right side of the head. That's the only packaging on the right side of the head, just above the metallic watch.
And is that the portion that's over the blood?
Yes.
So is that a halo seal itself, that object that's in the pool of blood on that other side of the head?
Yes.
From what you recall of the scene and the photos of the exhibits, how many halo seals in total are on this patient that can be depicted?
In this photo,
Yes.
3.
You've already described one on the chest tube. Where are any others?
One is around the crike, and then one is on top of that one.
Are you able to recognize the difference between the one that you applied to the crike and then the one on top of it?
Yes, if you look closely, the one around the crike tube is on the bottom left of the patient's neck.
And you're stating, look closely. Are we able to move this?
Hey, Government,
Yeah.
watch what you're doing here. What's going on?
I apologize. I'm going to pull the exhibit off for the time being, Your Honor, and see if we can zoom in.
Thanks.
Your Honor, we've zoomed in, same prosecution exhibit. I'd ask to publish at this time the zoomed in angle.
Any objection, defense?
No.
You may.
Thank you, Your Honor. Now, you were describing SO1 Byrne, that you're able to discern the difference between the two different halo seals in play on the neck here. If you could go ahead and permission for the witness to enter the well, Your Honor, to look at the exhibit on the big screen.
You may.
SO1 Byrne, if you could enter the well once again and explain to the members utilizing that photograph where the two different halo seals are.
The first halo seal is underneath. You can see the leading edge of it down here.
And what are you pointing at right now?
Just below the clavicle of the patient.
And are there any other identifying features or medical items in that area that you're pointing at?
This is the fast one, IV. Above.
And then where do you see the second halo seal that was not there when you left the scene in relation to your first seal?
The second seal is right here. That's the top tab of the seal.
And when you say top tab of the seal, what do you mean by that?
If you look at this seal up here, there's a pull tab of the seal to pull it out of the packaging.
Thank you, SO1. You can be seated again. And I'm removing the exhibit. What happened after you came back to the scene with that prisoner?
We were in that compound for a long period of time after that, and a lot of weird things started happening. There was photos taken. There was a re-enlistment ceremony. The actual patient was covered eventually, but we were stuck on target, or not on target, but in the compound for a long period of time.
Who was taking, or excuse me, let me rephrase. Describe for us the photos that were being taken. How did that happen?
Lieutenant Portier and SOC Gallagher were taking pictures, and a few of the enlisted guys were also in the pictures as well.
Were you in any of those photos with the patient?
I was.
What about the re-enlistment ceremony? Where did, can you describe that for us?
I don't have a great memory of the re-enlistment ceremony, but I do remember that it was close to the expired patient or ISIS detainee.
And what do you mean by close?
It was right next to it.
And who participated in that re-enlistment ceremony?
Most of the platoon that was on the ground that day.
Who was the person re-enlisting?
SOC Gallagher,
And who was the one re-enlisting him?
Lieutenant Portier.
Following the photos and the re-enlistment ceremony, what happened next?
We were there for the remainder of the day. I think we were supposed to shoot, almost shot a javelin at the end of the day, if I can remember correctly, and then we ended up returning to base.
What did you do with the videos? I played 2 of those videos files for your prosecution exhibit 15 and 16. Where did those go?
They went on the laptop when we got back to our base.
What do you mean by the laptop?
It was a red laptop that was used to compile all the platoon videos that was kept in our platoon space.
Whose laptop was that?
It was my laptop.
Who had access to that laptop during deployment?
Everybody in the platoon, including our enablers.
Did the laptop have a password attached to it?
It did not, no.
If I may have a moment, Your Honor.
You may.
No further questions at this time.
All right, members, we've almost been going 50 minutes, so I'm going to take a recess at this time. If you'd be back in your deliberation room at 20 of the hour, we'll continue.
All right.
Court is in recess. Everyone, please carry on. Petitioner Byrne, I just remind you, like the lunch recess, you're prohibited from speaking with anybody, including the counsel in this room, during the course of your testimony. Do you understand? Thank you.
And the photos you were using, I'll probably use those as well. Yeah.
Well, let's take it up when we're done with this witness again and see where I'm. Again, I think as we talked about before, we've given ourselves some time, but we don't want to steal from ourselves in case we need it later.
I feel like we're moving much faster than we originally anticipated.
All right, are both sides ready to go on the record?
Yes, Your Honor.
Yes.
Court will come to order. All parties previously present are once again present. The members are absent. During the 802, we discussed some scheduling. In general, that we still need to conduct a Daubert hearing. What's the name of that company? I'm sorry, it starts with a P. Parabon, thank you. Regarding the expert witness from Parabon, tentatively, we're going to take that matter up at tomorrow morning prior to the members' arrival. We'll have the members arrive late. That's if the government's experts will have arrived in town by then. The government indicated they had 2 other witnesses available this afternoon. The defense indicated that they believe some other witnesses were testifying this afternoon, and so made a recommendation that we complete this witness and then recess for the evening. The court said it would consider it when we completed the current examination. Any additions or corrections to my summary of that 802 conference, government?
No, Your Honor.
Defense? No. It was probably longer than the actual 802 conference. All right, are we ready to call the members, government?
Yes, Your Honor.
Defense?
Yes.
Would you ask the members to join us? Please be seated. Members, we continue with the examination of Petty Officer Byrne. Defense, you may proceed.
Good afternoon, Petty Officer Byrne.
Good afternoon.
You and I haven't spoken before, have we?
No, it's not.
Is this good? The microphone? How much time have you spent going over your testimony with the prosecutors?
I went over the testimony when I came in for prep the last week.
Yeah, how long of a session was that?
I would say maybe an hour or 2 hours.
How many different prep sessions have you had with prosecutors?
2.
And the earlier one, how long was that?
I think both were about an hour.
Did you go through a lot of that medical terminology you discussed here today with them?
We did discuss medical terminology.
Okay. All the different procedures that you discussed here today?
We did discuss procedures.
Okay. Now, I want to go through the procedures that you testified about. First of all, let's get the big question out of the way. You never saw Chief Gallagher stab this terrorist, did you?
I did not, no.
Okay. The first thing you saw him do was to assess the injuries. Is that correct?
That is correct.
Okay. And when you called him the patient, when the patient was originally brought in, he was on the hood of a Humvee?
That is correct.
Okay, the Humvee had a bullet hole in the windshield?
I don't remember.
Would it refresh your recollection to look at that video again?
Yes.
Either one.
Mr. Palatori, is the bullet hole visible in the video?
Not particularly relevant.
All right.
But I can go to the next question. Was there blood on the hood of the vehicle?
Thank you.
Of the vehicle?
Yes.
I have to see the picture again.
This one's more relevant.
Okay.
I kind of suspected we were going to get there, but. All right, no, the next one, and if you just show like the. Right. That to publish. Can you see the?
Yes, sir.
Oh, I think it
It's all right. Government, would you take it down off the big board, please?
was it limited publish that I.
If you would like to publish it, are you?
I just wanted to show it to him to see if it refreshes his recollection as to there being blood on the hood and a bullet hole in the windshield. You recognize that?
I see there's blood on the hood of the Humvee.
Okay, and that's the hood that they had pulled this patient off of?
I believe so.
Okay. How long were you standing there watching this patient before Chief Gallagher walked up?
I don't remember.
Okay. Was it 5 minutes?
I couldn't tell you the time.
More than 10 minutes?
Sir, I just said I couldn't tell you the time.
More than an hour? I mean, can you give us a ballpark? Doesn't have to be exact.
So you're trying to ask if it was...
About how long were you there with the patient before Chief Gallagher walked up?
I can't recall.
Can we guess, like, is it... Obviously, there's a big difference in 5 minutes or 5 hours. Okay, you weren't there with him for hours before Chief Gallagher got there, right?
Right. Definitely less than 5 minutes.
Okay, that works. And then once Chief Gallagher got there, he walked up and started rendering medical aid. Is that correct?
That's correct.
He triaged the patient?
Yes.
He checked the leg to see if there were injuries there? Correct?
Yes, that's what the video shows.
Okay. In the video, at one point, the patient turns. You remember that? When he grabbed the injury on the leg, the patient called out and turned. You remember that?
I do.
And at that point, Chief Gallagher pushes him back down, right?
I remember that.
Okay. Do you remember Chief Miller ever walking up and using his foot to push you down by the chest?
I do not.
Out of curiosity, would that be painful for somebody with blast lung?
To push somebody down by the chest.
Yeah.
I can't speak because I've never had blast lung on that. So the blast lung is an actual injury to the alveolar tissue of the chest. So it's no actual injury to the outside of the chest. It's an overpressure injury to a hollow organ inside the patient. So I can't speak intelligently on whether or not it would hurt a patient or not.
Well, would it be pretty painful inside the chest if you had blast lung?
Would it be pretty painful inside the chest?
Yeah. You gave him ketamine, right?
I did give him ketamine.
Is that because it's pretty painful to have blast lung?
No, ketamine was given because of the procedures and the mechanism of injury to the patient.
Okay. And do you keep records of what drugs you use?
We do have records of drugs we use.
Okay. Do you have records of whether you used ketamine or maybe fentanyl?
I used ketamine on this patient.
Right. My question was, do you keep records of whether you would have used ketamine or fentanyl?
Yes.
You do have records of that.
Whether I used, do we have records of
Yes.
ketamine or fentanyl?
Yes. I mean, these are both controlled substances, right?
Yes.
Okay. And you have to sign them out, right?
We signed them out on the beginning of employment.
Okay. And when you use them, you have to document them, right?
We do.
Okay. Did you document anywhere which substance you used on this occasion and how much?
I documented that I used ketamine on an Iraqi.
Okay. Where did you document that?
It would have been in my records.
What records?
I've documented that we used ketamine during deployment in our med records.
Okay. So where would you have written down, I used ketamine on ISIS terrorist or patient? Or
I did not write it down that I used it on the ISIS patient.
Okay. Is there any records anywhere that would indicate what you used on this day versus, or are we just talking about throughout the whole deployment?
Throughout the whole deployment.
Okay, so you only document the gross number of, what are they, vials or whatever of ketamine that you've used throughout the whole deployment, right?
I documented the vials that we used on deployment.
The entire number, right?
The entire number.
Right, the gross. I mean, do you break your records down as to what drugs you use on each individual patient? Or do you just document, hey, I used, 20 units of ketamine the entire deployment?
We should have it for each individual patient.
Okay, did you do that for this patient?
I did not know.
Why?
Because of the sensitivity around the day and the issues that the platoon was having with what happened on that particular day.
So
From the leadership down.
So because of the sensitivities of what you'd say happened on this day, you chose not to document what type of painkiller you used?
We were directed by our leadership, our chief and our OIC, to erase pictures and not.
Oh, I'm sorry. I'm not asking you to go off and talk about pictures. I'm asking you very specifically, you're required to write down what drugs are used on each individual patient, yes or no?
Yes.
You didn't write down what drugs you used on this particular patient, yes or no?
I did not write down.
Okay, and you say that you didn't write that down because of sensitivities within the platoon about what happened this day, yes or no?
We did.
It's a simple question, yes or no?
No, we did not.
When he came in, you said that he looked like he was near death. Is that correct?
The patient did not have a good presentation when the treatment was initiated.
You said he looked like he was near death, right?
I did not say he was. In my testimony?
Yes. Did you say he was
He
near
did
death?
not have a good presentation.
Did you ever say he looked like he was near death?
I may have said that he was near death at one point or
Did you
another.
tell NCIS when you first met with him that he looked like he was near death?
Your Honor, can I reference my initial statement?
You should answer the question asked. If you don't know the answer to the question asked, say you don't remember.
I don't remember.
When looking at the transcript of your initial statement, NCIS help refresh your recollection as to whether you said that he looked like he was near death.
Absolutely.
All right, may I approach?
You may. You may take the statement.
Take a look at it. Just directed you to the center of the page. But
Yes, right here.
okay. So when you were initially interviewed by NCIS, you said that he looked like he was near death. Is that correct?
Yes.
After that, you observed Chief Gallagher perform a crike on him, right?
I did.
You checked it to make sure it was done correctly?
I readjusted the crike and put the halo seal around the tube.
Okay. And then there was needle decompression done on both sides or one?
I can't remember exactly, but I believe both sides.
Okay. Who performed those?
I believe SO2 Villanueva.
Is SO2 Villanueva a medic?
He is not.
Was he trained in doing needle decompressions?
He was.
Who trained him?
He was trained in SQT,
Okay.
in TCCC training. And he was also trained within the platoon. All SEALs are trained on needle decompressions, on how to do the procedure.
Why did he do them instead of you or Chief Gallagher?
He was there to observe, and he assisted while we prepared the chest tube. Because the chest tube is a definitive treatment for blast lung.
What does that mean? It's definitive treatment.
Okay, so when you are initially presented with a pneumothorax or a hemothorax or some type of positive pressure in the chest, you decompress it with a needle thoracentesis, which would be a 10 gauge or a 14 gauge needle that come in every operator's TCCC kit or every operator's blowout kit. Every every pneumothorax or hemothorax, the definitive treatment is a finger thoracostomy, where you cut into the 5th and 6th intercostal space, which is right on the side of the ribs, and express fluid or air out, or in a hospital setting, or the most definitive treatment. When I mean definitive, I'm talking about the end treatment is a chest tube.
When you say the end treatment is a chest tube, so if you have somebody with blast lung and you get the chest tube in, does that mean that they're now good to go, that they can get up and walk back into the fight?
No, not at all.
You would have to, at that point, medevac them, correct? Or get them to a higher level treatment facility?
They would be needed to, anybody with blast lung, it's an extremely hard thing to treat in the field. So yes, it would need to go to a higher echelon of care in a reasonable amount of time.
What is a reasonable amount of time?
Can you be more specific with that question, sir?
So from the time that you're in a building that gets hit with 2 Hellfire missiles and initially sustain the blast lung, how much time is reasonable to then get them to that higher level for treatment facility?
It depends on.
Action calls for expert opinion.
Overruled.
I'm not a doctor, but it depends on. It could be anywhere from 30 minutes to a couple hours.
Okay. Where was the next level treatment facility in Mosul?
It was our base
Where's that?
in Badouche.
How far away is that?
Probably about 30 minutes.
Was this patient ever being prepped for transport back to Badouche?
I'm not aware of the, that is a tactical call of the chief, the OIC, and the JTAC.
Right, my question is, did you observe anybody preparing this patient to be transported to Badouche?
The patient was being actively worked on. Chief Gallagher was running the scene.
Just answer the question I'm asking.
Yes,
Did you ever see this patient being prepared for transport to Badouche, yes or no?
yes,
You did see him being prepared for transport.
yes.
He would have been transported on a stretcher?
Whichever transport the partner force would have taken him on.
So we wouldn't have transported him, ERD would have transported him.
I have never been in that situation with an enemy combatant or an enemy patient, so I don't know the answer to that question.
Okay. There was the band put on his left arm. That's to put an IV in, is that correct?
That's correct.
Did you do that?
I believe I did.
Okay. Did you ever put the catheter in for the IV?
I believe we went for the fast one, which would be indicated in this situation because it's interosseous device.
Did you ever put a catheter in for the IV?
I cannot remember.
Okay. Would it help your recollection if I showed you a picture?
Yes.
Okay. You could please just listen to the questions I'm asking and just answer the ones that I'm asking instead of giving your own narration. You see that picture?
I see the picture.
Does that refresh your recollection as to whether you ever put a catheter in for an IV?
I can't tell or not by looking at the picture.
Do you see a catheter in the arm anywhere?
I do not see a catheter in the arm.
Okay. You said that you decided to go for, what did you call it, the quicker method?
No, the most definitive method that you would use on the battlefield.
Which is the interosseous?
That is correct. That is actually the standard of care that is being put out at our schoolhouse now for severely injured trauma patients.
What about in 2017? Is that the standard of care that was being used at that time?
Yes, it was.
Okay. So why did you put the band on his arm?
I probably started to look to see, because you want to try to get, sorry, I misspoke. I went probably looking to see if I could get IV access and then decided to move to a faster, more expedient method called the fast one.
When you say looking to get IV access, that means look to see if you can get a vein, right?
Yes, and if you look at that picture, sir, I don't see, there is no veins.
Right.
So that probably explains why I went to the fast one.
And this kid was relatively thin,
He looks thin in the picture. Yes.
okay? And lack of veins is generally, that's something that you would see if there's no blood pressure, right?
No,
Low or no? Low or no blood pressure, correct?
Not necessarily.
That's one possible though, right?
I mean, I can't speculate on that, but that's a possibility.
Okay, either way, you couldn't find the vein, so you decided to go to the interosseous, correct?
Yes.
Okay, did you do that?
I can't remember.
How do you do that?
It's a simple procedure. You take the butterfly outline, and you put it on the sternal notch, and then it lines up the sternum perfectly. You push the fast one into the sternum, and then your IV is established.
Okay. Then what?
Then you have an established IV on the patient.
Then what?
And then you can either hang fluids or hang whatever you need on the patient.
And what did you hang on this patient?
I didn't hang anything on the patient.
You went through all these procedures to be able to get an IV on him, but you never actually gave him any fluids?
No, because with blast lung, hanging fluids is contraindicated. But with every major trauma patient, you have to establish a solid IV line.
But if you're not going to give him fluids, the IV line would be to give him drugs?
It can be used to give fluids or drugs.
Okay, so you could have put fentanyl in there?
No.
You can't put fentanyl in there?
Oh, you can put fentanyl in there.
What about Narcan?
You could put Narcan in there as well.
What other substances did you carry with you on that day?
Midazolam.
What's that?
It's a narcotic that we have in our kit.
Okay, that's a painkiller?
It is.
Okay, what else?
Benadryl.
What else?
I believe that's it.
Adrenaline, anything like that?
We have adrenaline in the truck kit,
Okay.
just in case, but not many operators have heart attacks. But we do have it in a resuscitation kit.
Okay, you do have Narcan?
We do have Narcan.
Okay, and fentanyl?
We do have fentanyl.
Okay. At a certain point you left, is that correct?
I did.
You left because you forgot your sunglasses upstairs, right?
I was also actively operating the Puma when the patient came to our compound.
You left because you were operating the Puma when the patient came into the compound? What does that mean?
I went back to what I was doing prior to treating the patient.
Oh, which was operating the Puma.
That's correct.
Okay. Didn't you tell NCIS that you went because you forgot your sunglasses upstairs?
It was upstairs with the rest of my gear, but I've cleared that up since then.
You've cleared that up since then?
I've been asked, and what I meant was my gear and my stuff on the second deck of that building that we were in.
So you initially told NCIS you went to get your sunglasses, and then you later cleared up your statement to add the rest of your gear and go back to operating the Puma?
Well, I was also up there. My sunglasses and all my stuff was up there with the Puma equipment.
So if you were operating the Puma at the time that the patient came in, it's up in the air flying?
I can't remember specifically, but it would have probably auto-landed at that point.
Okay. So if you drop it and walk away, it lands itself?
It does.
Okay. Is that the only drone that you guys have?
No, we had DJI drones as well.
Okay. And the Puma is a fixed wing type drone, right?
It is.
And where's the DJI? That's a quadcopter?
It is.
Okay. And after the re-enlistment ceremony was concluded, did you have an opportunity to operate the DJI drone?
I did myself and SOC Gallagher and a few other guys.
I asked if you did.
Yes, I did.
Okay. If you could listen to the questions here instead of trying to volunteer extra information.
Yes, sir.
So you had an opportunity to operate the DJI after that, right?
I did.
Okay. What about Chief Miller?
I don't believe Chief Miller operated it.
Okay. Did you take some videos when you went out to operate the drone?
I did.
Okay. Well, actually, at a certain point in time, did Petty Officer Pullman have a health issue?
He did.
How long after was that before or after the re-enlistment ceremony?
I can't remember.
Was it before or after treating the ISIS patient?
I can't remember.
You treated him with an IV, right?
Petty Officer Pullman?
Yeah.
I believe it did.
Okay. Did you videotape your treatment of Petty Officer Pullman?
I might have.
Okay. I'm going to show you a video. Oops, hold on a second. And this is
Did you intend to mark this as a defense exhibit?
yes, Your Honor, I would. It's the file number 301. So I'd like this is defense.
It'll be Charlie.
All right, you want me to play it for the witness?
You may.
Do you recognize this?
Yes, that's our vehicle.
Okay. Do you recognize this video?
I do.
Hmm?
I do recognize the video.
Okay. Do you remember what's occurring in the video?
It appears that I'm preparing IV.
Do you see somebody getting into the vehicle?
Yes.
Is this video a fair and accurate representation of what was occurring at the time?
Yes.
And I would like this moved into evidence as Defense Exhibit Charlie and words for identification removed.
Government, any objection?
No, Your Honor.
Without objection, Defense Exhibit Charlie for identification submitted evidence. The words for identification will be stricken.
I'd like to then mark 302. I think it's probably easier to go through them with the witness and then play them sequentially for the jury.
All right. Is your intention to have each of them individually marked?
Well, 301 to 303 can be, kind of one block, and then 304 and 305 can be separate ones. If we want to do 301, 302, and 303 is like Charlie 1, 2, and 3.
All right. It may or may not be necessary again, but this should probably be worked out with a court reporter ahead of time, but I'll mark these.
Then we'll have 304 pre-marked as Delta and 305 as Charlie, or as Echo.
All right, so I'm going to rescind my admission of Defense Exhibit Charlie. It is still for ID. We've covered 301. We're now going to cover 302, so go ahead.
Can you see that?
Yes.
Do you remember this video?
I remember giving him an IV.
Okay. This video is another 2 minutes long. Do you need to see the rest of it?
Let's pause for just a second. So, are you showing them to the witness for purposes of authenticating the
This is
videos?
just authenticating right now, Judge.
All right. Government, do you have any objection to the authentication of the videos marked 301, 302, 303, which comprise Defense Exhibit Charlie for identification?
No, Your Honor.
All right. Then without objection, Defense Exhibit Charlie for identification is submitted evidence. The words for identification will be stricken. Again, for purpose of the record, those comprise 301, 302, and 303.
Okay. And I would like to then just publish to the jury 303 because that one more sets the timeline. The other ones are just kind of long videos of him putting the IV in the truck.
All right. You would like to publish 303? You may do so.
And we don't even have to go through the full thing. Just
All right. You just want to publish a portion of it?
Yes.
Which portion do you want to publish?
just enough until the witness identifies a couple of things in it.
Okay. Go ahead.
How you feeling? Good.
Did everybody see it?
Okay, I just have better. Feel them veins. All right. Yeah.
Looking in the
Okay.
background, do you see anything on the ground?
Yes, I do.
So this video was taken after
All right, put it on.
after the incident with the ISIS patient?
Yes.
And just to be clear, what you see in the background is the ISIS patient himself,
Yes.
now covered with a blanket?
Yes.
All right. I'm now going to play file number 304 for the witness, which has been marked as defense Delta for identification, I believe.
The purpose for playing it for the witness?
Authentication, if the government will.
All right, defense exhibits Delta, which comprise 2 videos that have been marked 304 and 305. Government, do you have any objections to authentication? Any objection, I should say, as to defense exhibit Delta for identification?
No objection.
All right. Then without objection, defense exhibits Delta for identification is admitted evidence. The words for identification will be stricken.
All right. At this point, I'd like to publish these videos to the jury, the 304 and 305.
All right, you may.
Everybody see?
Is that an affirmative response from all members?
Craig, make it do a trick.
Who's that operating?
Hold down.
Hold on what?
Press and hold the down elevation. As soon as someone touches it, grab it.
Right here? Hold
Yeah,
down.
hold it all the way down. As soon as someone touches it.
Yeah. Now what?
That's it? Yeah.
And this is right after the re-enlistment ceremony as well?
I don't remember the sequence of events with the re-enlistment ceremony.
Well, this one is file number 304. The original video that the government showed you were 294 and 296.
Right.
So the next one that I showed you in the truck was, I believe, 301. So these would be after. Is that correct?
Okay.
So this occurred after the re-enlistment ceremony, correct? Well, file number 304 you would have recorded after file number 303, correct?
I don't understand.
Your video records these files and gives them a number file name, correct?
That's correct.
Okay, so
I believe.
if 303 is you with Petty Officer Pullman working with the IV where you can see the dead ISIS terrorist in the background, that one's right after the re-enlistment ceremony, correct?
I don't know where the re-enlistment ceremony.
You don't know where the re-enlistment ceremony was?
I don't understand your question.
Okay, well, let me rephrase. The video of you and Petty Officer Pullman out there where you can see the ISIS terrorist in the background, that is after all of the medical treatment of the ISIS terrorist has been completed. Is that fair to say?
Yes, that's after the medical treatment.
Okay, and that's file number 303, right?
I just see them as videos, not as files.
Okay, but your camera labels them as sequential file names, right?
That's sure, I suppose.
How do you take the files off of your camera and put them onto your computer?
You just put them on, plug in the memory card, and it goes onto the computer.
Okay, and do these files have separate names?
I'm sure they do.
Do you give them separate names? Or does the camera automatically give them certain names?
The camera would give them sequential names.
Sequential numbered names, right?
Right.
Like 1, 2, 3, 4,
Okay.
301, 302, 303, right?
Right.
So can we agree that 304 comes after 303?
Yes, 3 comes after 4.
Okay, good. And in this one, you see Chief Miller there, right?
I do.
Who are the other two people?
S1 Dylan DeLay and Gio Krylo.
Okay.
Can I just state for the record, we're stopped on the video at the very end, the 31-second mark. Is that
Yes,
correct?
this is the final frame of the video. File number 304, defense Delta 1, I think.
Thank you. Just Delta.
And Petty Officer DeLay, is he the one standing right next to Craig Miller?
He is, yes.
Okay. I'm not going to play 305. Can I just do it, or do I need to take it off and then?
Oh, are you just cutting over?
Yeah.
If you do it quickly,
I can move it down. Can you all see it on your screens? Okay. Do we need it up there to get the noise? Okay. You're operating the drone here, correct?
This is
Who's that standing on the right?
I believe just to the right of me was SOC Gallagher, and then that is the other one on the right is Josh McCandless. That's Lieutenant Portier.
Again, I didn't ask you where Chief Gallagher was. I asked you who you see on the right hand side of the screen. What are you doing with the drone here?
I am flying in the courtyard.
Around.
It is around the expired patient.
Okay. Can you see another individual in that video on the right hand side?
Yes.
That's Chief Miller, isn't it?
Yes.
You told NCIS that you thought that the patient appeared to be in his 20s. Is that correct?
I think the patient was in between teenage years and early 20s. That's correct.
Okay. So you never tried saying he was 12, right?
The patient?
Yeah.
The patient looked young, but
Not 12.
I can speculate on the actual age of the patient, but he looked, I believe my statement was, you said
20s.
teens or 20s.
I said 20s, but would it refresh your recollection if I showed you the transcript from your NCIS interview?
Yes.
I'm sorry.
Bertano.
Not particularly, no. I mean,
No, not out loud. Just read it to yourself and see if that refreshes your recollection. Okay, so you told NCIS that you thought that he was definitely like in the 20s, probably, right?
I would say he's in his teenage years or 20.
Told NCIS definitely like in the 20s, probably. Yes or no?
That's what it says.
Okay. You've also told NCIS that ISIS used kids that were totally capable. correct?
That is correct.
Told them that ISIS came in all shapes and sizes. Americans, Chinese, African American, French people. Described ISIS as a melting pot. Remember that?
I did.
Said they were from big beards to kids. People that look like Iraqis or look like kids that were totally capable. Remember saying that?
Can I see that on the?
Sure.
Can I ask Mr. Peltor, why are we refreshing his recollection on this matter?
Just because he has to see it.
Well, I guess I'm asking, why are we inquiring as to what he said to NCIS? Why are we not just asking him
Just
his current opinion?
your current opinion is that they were using young people that were totally capable as fighters, correct?
Thank you.
ISIS was using all different types of people.
Okay. Now, you as the platoon medic, you went out on a lot of missions, is that right?
I did.
And so while the rest of the platoon was generally split up into two different sectors or squads, and they would go off, week on, week off, you went out almost all the time, right?
I did.
And you went with Chief Gallagher several times to the towers for sniper operations, is that correct?
I did.
And you never saw him shoot anybody who shouldn't be shot, right?
Mr. Peltor, I was up there in the capacity as a medic.
Well, so you never saw him shoot anybody he shouldn't have, yes or no?
No, I was never on the sniper rifle while he was shooting.
You never saw him shoot anybody he shouldn't have, yes or no?
No.
Okay. One second. No further questions.
Redirect?
Yes, sir. Were you in a position, SO1, to be able to see who Chief Gallagher was shooting at when you were with him on those sniper missions?
I could see the general direction, but I couldn't actually see anything out past a couple thousand meters.
Why
A
not?
couple hundred meters, sorry.
Why not?
Because most of the time I was up in the sniper hides. I was there in a capacity as a medic, not as a sniper.
Did you have a scope, a scoped sniper rifle with you?
There was some times that I was able to carry the 50 cal Macmillan to the sniper hides.
But was your role to be watching, to be serving as a spotter for Chief Gallagher?
To be serving as a spotter.
Yes. Was that your role?
No, it was not my role.
You testified a little bit about the patient's condition when you first saw him. How about his condition after you assisted Chief Gallagher with the treatments you described? What was his condition like when you left?
As I said, there was rise and fall of the chest, and the patient was alive when I left him.
Did he appear stable at that point?
He appeared stable.
Did you ever give him Narcan?
No, I don't remember giving the patient Narcan.
Did you give him fentanyl?
No, I did not.
Were any of the procedures that you took part in with that ISIS patient unnecessary based on the presentation of his condition that you were faced with?
No, the procedures we did were reasonable and necessary given the presentation and the circumstances.
One moment, Your Honor. Your Honor, at this time, we'd ask for a 39A session outside the presence of the jury.
Members of you, excuse us just for a few minutes.
All rise.
Everyone please be seated. Dermot, go ahead. Does the witness need to be excused?
Your Honor, I think based on previous sessions, it may be relevant to ask him some questions related to a 404B ruling of this court.
All right. Would you like to voir dire the witness?
Yes, thank you, Your Honor. While you were with Chief Gallagher on some of those sniper missions that the defense was asking about SO1, did he make statements to you about what he was shooting at?
Yes.
And what did he say?
One time he shot a male, an elderly male, with a rocket behind a wall.
Did he say anything about whether that elderly male was armed or unarmed?
He did not specifically say if he was armed or unarmed. He said he came around the corner and was holding his torso.
Any other statements he made about targets that he was shooting at during that period?
There was on the first tower, females at the riverbank.
So you say females at the riverbank. What specifically do you recall Chief Gallagher stating about those females at the riverbank?
He said he was going to engage the females on the riverbank.
Did he make any statements regarding whether they were armed or unarmed or had any hostile intent?
He did not make those statements.
One moment, Your Honor. Your Honor, at this point, I think we've laid the foundation of what we intend to elicit. And
Okay. Defense, do you desire to voir dire the witness or to make an objection at this time?
If I could have the base stamp numbers of when we got notice of this? As to that one, he said he doesn't know if he's an enemy combatant or not.
we're looking for the
I'm just
transfer.
trying to, I think first we're retrieving bait stamp numbers, and then I've just asked whether you desire to voir dire the witness or do you want to make an objection.
Okay.
So let's just get sequenced here.
Okay.
Defense, do you desire to voir dire the witness?
Yeah, so it's just these two?
Yes.
Okay. So, when you say that he shot a rocket at somebody, you don't know if that was an enemy combatant or not, right?
I do not.
So he certainly could have been an enemy combatant, right?
Yes, there's a possibility.
So your testimony is that he shot a rocket at somebody who might be an enemy combatant, and then he said, I got him. Right?
Can I see the?
Now, I'm asking you, based on your memory, you're saying he shot a rocket at somebody who might be an enemy combatant, and then
Yes,
he
sir.
said, I got him.
He shot a rocket at somebody from behind a wall,
Uh-huh.
and that individual came out from behind the wall and appeared to be holding his stomach.
Okay? And then he said, I got him?
No, he used a sniper rifle after that.
Okay. But that very well could have been a combatant. Right?
Yes.
You don't know?
I don't know.
Okay. And then the other incident, where you say that he had fired at women, you also heard intelligence at that time about ISIS using civilians for resupply and ISIS dressing as women. Is that correct?
Yes, we heard that from Gio Krylo.
And he told you that immediately prior to this this alleged shooting, right?
Not immediately prior, but he put it out.
Okay. So that also could have been lawful combatants, correct? Or, well, that also could have been combatants that he was shooting at, correct?
Correct.
The shooting at combatants.
Hold on just a second. Professor Byrne, can I, as to the shooting of the females at the riverbank, could you tell me again, what specifically did Chief Gallagher say to you regarding that?
He said that there were women on the riverbank, and he engaged them.
And he was going to engage them?
He did engage them.
And he did engage them? And do you recall when this occurred?
This would have been when we were at the two towers.
But do you recall when during the deployment this might have occurred?
Towards the end of deployment.
Oh. Government, any questions in light of my question?
No, Your Honor.
Defense, any questions in light of my question?
I just have one other section to ask him about from his NCIS interview. If there's any question about these, I mean, they seem to be all clearly potential combatants, but.
Well, you're free to ask him some additional questions. I'm just trying to sort of establish what might be said here in front of the members for purposes of the objections.
During your interview with NCIS, were you asked, did you ever see him shoot anybody that shouldn't have been, that he shouldn't have shot? And then answered, no, I did not personally. It was weird though, because I was there. Like next to all the snipers, because I was providing medical, I was a medic. So I heard talk about it, but I didn't, I mean, I wish I could help you out there, but I didn't actually see him shoot other people. Did you say that?
I did.
Does anybody desire to question Professor Byrne any further, government?
No, Your Honor.
Defense?
No.
All right. Professor Byrne, would you mind stepping just outside the door right here?
Yes, sir.
Thank you. All right, so the government intends to elicit these two statements. Defense, do you have objections then to either of those two, to the eliciting of either of those two statements?
Yes, Judge, I did.
All right, what's the basis of the objection?
It's a 403 objection and a 404B. What we're talking about here is two incidents where he didn't personally observe the shooting. He has no information that these were not enemy combatants, or that these were in any way unlawful. The fact that they got intelligence that ISIS was dressing as women right around the same time that he is allegedly shooting, engaging somebody down by the water, resupplying, prejudicial effect of this significantly outweighs any probative value.
Government response?
Your Honor, I think especially as it relates to the statements, because what he's talking about is Chief Gallagher making statements about what he's engaging, so it's not in contradiction to him saying he didn't see him shoot at him. It fits within the negligent discharge of the firearm, and it fits within this court's 404B ruling on statements made by Chief Gallagher to members of his platoon about the people that he was targeting throughout that deployment.
There is no information from what we just elicited that any of these were negligent discharge of the firearms. In fact, he has no idea whether these were combatants or not. So to try and make that jump without somebody who ever looked down the scope to be able to say anything about that is purely prejudicial. There's really little to no probative value about this. It also goes beyond the scope of the cross. In the cross, I simply asked him about whether he had ever personally seen him shoot anybody who shouldn't have been shot.
All right. The objection is to the first statement regarding shooting an elderly man with a rocket behind the wall is sustained. The court doesn't believe that that's relevant to any of the offenses before the court. However, the court overrules the objection as to the testimony that the accused said he, regarding the two females in the bank, said that he was going to, or that he did engage them, a statement that occurred towards the end of the deployment. The court concludes, applying a 404B analysis, that the preponderance of the evidence supports that the statement was made based upon the testimony of Petty Officer Byrne. Two, that it is relevant both to specification 2 of the additional charge as potentially evidence related to the shooting of the young female alleged in that specification, or specification 1 of charge 3, a willful discharge of a firearm at civilians. Finally, the court concludes that its probative value as it directly relates to those two offenses is not outweighed by the danger of unfair prejudice. So the court will allow the government to ask the witness regarding the accused statement regarding the females on the riverbank. Any questions on the court's ruling, government? Let me just say this. As to beyond the scope, to the extent that it is beyond the scope, the witness is subject to recall. The government would be entitled to recall Petty Officer Byrne to come and testify to those items if it wished to. As a result, in the interest of expediency, the court will allow the question to be asked now as opposed to later. Sorry, government, did you have a question about the court's ruling?
In light of the court's mixed ruling on the separate instances, I would ask for permission to ask a leading question to hone in on only the second incident and avoid anything from the
Yes, I'd ask you to lead him in to make sure that you get on it and he doesn't stray anywhere.
Yes, sir.
Defense, any questions on the court's ruling?
Yes, Judge. So I just want to understand, because you referenced the additional charge, so you're saying that asking about what might have been ISIS terrorists dressing up as adult women is relevant as to whether he shot a teenage girl? That sure sounds like propensity to me.
I'm saying that this is direct evidence that he may have shot the girl contained in specification 2 of the additional charge. It is your duty to cross-examine him as to whether it's possible that when the accused referenced 2 females, they might have been ISIS fighters dressed up. But those are your words, not the witness's words.
I understand that.
All right.
But can I ask, because the testimony related to that charge is that he shot at one teenage girl who was part of a group of 4, whereas here he's talking about 2. It seems like we're, without any information about date, time, place, anything like that, that we're kind of making a giant leap as to any potentially appears to be female target, and it seems like we're getting into propensity.
All right. Thank you very much. No, I don't believe we've done propensity. I've set my Reynolds analysis on the record. All right. Anything else we need to take up prior to recalling the witness, government?
No, Your Honor.
Defense?
No, Judge.
All right. Let's ask Petty Officer Byrne back in, please. Petty Officer Byrne, if you'd return to the witness stand, thank you. Are we ready to recall the members?
Yes, Your Honor.
Defense, are we ready to recall the members? Defense.
Yes.
Okay. Would you ask the members to join us? Everyone, please be seated. Members, I sustained part of the objection, overruled. Sorry, there was no objection in front of the members. My apologies. Government, you may continue.
Towards the end of your deployment in 2017, was there an incident in which Chief Gallagher made a statement to you about engaging a group of women with his sniper rifle?
Yes.
Did you witness him after he made that statement discharge his weapon?
I did.
Nothing further.
When was this?
Sorry, hold on just a second. My apologies. Just give me a second. It gives me a chance to catch up. It gives me a chance to make sure the courtroom is reset. All right. We're all reset. Please cross.
I apologize. When was that?
Towards the end of deployment.
Where?
In the towers.
Did you see this alleged group of women?
I did not, no.
Do you know whether they even existed?
Just by what Chief Gallagher said to me.
Do you know whether they were in fact women?
I did not see the women.
Okay. Did you receive intelligence immediately before that, or sometime shortly before that, that ISIS was using civilians for resupply?
We were told that.
Okay. Did you receive intelligence right around that time that ISIS was dressing as women?
We were told that as well.
Okay. Under the ROE, that would have made them lawful targets if it was one of those two instances, wouldn't it have?
That's what was told us by Lieutenant Portier.
Okay. Do you have any information whatsoever that this incident that they just asked you about was unlawful in any way?
I didn't see the women.
So that's a no?
No.
No further questions.
Redirect.
No, Your Honor.
Members, are there any questions for this witness? That's an affirmative response from Commander Carlson. Bailiff, would you retrieve the question for me? All right, I have what's been marked as Appellate Exhibit 156. Minister Byrne, during Chief Gallagher's triage of the wounded fighter that appeared on your helmet camera was initially on, but then you turned it off. Why did you turn it off?
I turned it off to go get my med bag, I believe.
Was it SOP to turn your camera off?
I turned it back on during the treatments.
Was there a policy regarding recording of providing medical care?
No, there was not.
Any additional questions from the members? That's a negative response from all members. Government, any questions based upon the members' question?
No, Your Honor.
Defense, any questions based upon the members' question?
Hold on. Sorry.
Go ahead.
There were additional videos taken during the treatment, is that correct?
That's correct.
Okay. And those were not turned over to the government? Just yes or no?
No.
Okay. No further questions.
Government redirect.
One moment, Your Honor. Did you provide that laptop, that Alienware laptop, to the government?
I did.
Did you delete any of the videos on it?
I did not.
Nothing further.
Cross.
If you had to leave the videos, that'd be an obstruction of justice, correct?
That'd be correct.
You don't want to admit to obstructing justice, do you?
I didn't delete those videos.
That's not what I asked you.
No, I did not delete those videos.
That still is not what I asked you.
Counsel, I believe the problem is it's a little bit like when did you stop beating your wife kind of questions. I'm not, so if you'd like to rephrase.
I think the point's been made. My wife is laughing at you, Judge. She's going to get me later.
Redirect.
Yes, Your Honor. Are you testifying under a grant of testimonial immunity?
Yes.
And does that grant of immunity allow you to perjure yourself?
No.
Nothing further.
Cross.
No, thank you, Judge.
Members, are there any additional questions for this witness? That's a negative response from all members. Government, is this witness subject to recall?
Yes, Your Honor.
Plaintiff Byrne, you are temporarily excused. During the pendency of this trial, you're directed not to discuss your testimony with anyone other than the counsel in this room. Do you understand that?
I understand.
You're excused. Thank you.